Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help you learn more about client intake forms and how to effectively incorporate them in your practice to successfully evaluate client health. A client intake form is a questionnaire that clients fill out before their appointment with you. Typically, client intake forms improve the onboarding process by gathering all relevant client information, including insurance, emergency contact, and other health details. The client intake form covers a range of components, including patient information such as date of birth, phone numbers, and addresses, as well as emergency contact details. This is in addition to insurance provider information, as well as referrals, and of course, the main healthcare concern, which is guiding the patient's visit. All types of healthcare professionals can use client intake forms, including doctors, nurses, healthcare assistants, dentists, and more. The first step of completing a client intake form is, of course, handing the document to your client for them to fill out. The next step is to make sure that the client fills in all the relevant sections. If there are any gaps, please consult them during your appointment to ensure that they are filled. The final step is to safely store the document to protect your client's information. Here's an example of what a completed client intake form looks like. Feel free to pause the screen at any time. To use client intake forms in Carepatron, click on the Templates tab. To find client intake notes, filter by intake, and also make sure you're filtering by community to view our entire collection. If you want to be specific, type in the keywords client to find the relevant note. Click on the template you like by selecting the Choose Template icon and then select your client. This will then bring up the Draft tab, where, as you can see, all relevant information is created for you.